Hello everyone, I am Dr. Jatinder Singh. I work at Eye Foundation Group of Hospitals as a retina consultant. I am here to talk to you about the retinal diseases. What is retina? Retina is the back part of the eye where the images are formed and then is transmitted to the brain. Because of certain diseases like diabetic retinopathy, the retina becomes weak, and subsequent to that the images are not clearly formed and it can temporarily or permanently affect the vision. So these diseases which like our common presentation in our clinical practice affect the patients in a way that involves their disturbance in lifestyle, and they are unable to perform their routine activities like driving, reading, etc. The most common problem that we face is the patients presenting late. The disease fortunately gives us ample time. Even before the symptoms have initiated, the disease is already there in the eye. So it is necessary that patients who have diabetes should get their eyes, especially the retina, examined thoroughly by a specialist. In the early stages of the disease, patients are not having any symptoms. However, when the symptoms start, sometimes the disease is already late. So diabetes eye disease, as we call it, affects the vision in two primary ways. One, it affects the central part of the retina, which is called as macula, and the macular edema or the swelling of the central part of the retina causes significant disturbances. Initially, the patients present with blurring of vision, distortion of vision, and inability to perform near vision activity. The other complication of diabetic retinopathy is unmonitored and untreated. It goes on to a stage called as proliferative eye disease. In proliferative eye disease, there is growth of new blood vessels on the retina, which with minor eye movements can bleed, and sometimes the bleeding is significant enough to cause complete loss of vision. Fortunately, both the conditions, proliferative diabetic retinopathy and diabetic macular edema, have treatment. And the treatment for diabetic macular edema primarily is with intravitreal injections, that is, the medicines that are given into the eye with the help of a needle. The main concern of the patient who are advised intravitreal injection is pain. I'm here to assure you that this is a relatively painless procedure and it just takes a moment. And just to alleviate the apprehension that the treatment is going to cause them distress or discomfort, is something which needs to be busted. After the eye disease has been left unmonitored and untreated, it can cause permanent loss of vision. Some patients can go to a stage where they would need a surgery to rectify the problem. Once the disease has been treated completely, the loss of vision, which is sometimes not completely recoverable, can be taken care of by special glasses or with help of vocational training. We discovered this disease when there is significant symptoms. The patients initially present with symptoms like distortion of vision or blurring of vision. In that case, the patients are treated with intravitreal injections. When the disease has gone to the proliferative stage, that is when there is growth of blood vessels on the surface of the retina, we can do something called as a laser photocoagulation or laser therapy, which can cause regression or resolution of the new blood vessels, thus preventing them from bleeding into the eye and causing further aggravation of symptoms. Once they have bled into the eye, again, there is an option to give injections and take care of bleeding temporarily, which allows the blood to settle down and then can be treated with laser photocoagulation. However, in certain cases, when the disease has been left untreated, it can go to a stage of advanced proliferative disease where there is formation of membranes, and this is something which definitely would need surgery to rectify the problem. The key I would want to stress upon is that the disease goes beyond a certain stage. The vision is sometimes not completely recoverable. So my friends, first thing, if you have any of your relative has a diabetes, please ask them to get thorough screening of the retina to evaluate the retina and look for diabetic retinopathy, so that any advanced disease and permanent loss of vision can be avoided. Thank you for your kind listening.